CCDF program is made up of 3 broad and overlapping areas. The first is child care financial assistance or subsidy payments to families, and we'll cover this more on the next slide. The second is quality improvement activities. So these are activities that improve the quality of child care services as well as access to high quality child care for families. So for example, this could include a quality rating and improvement system or professional development opportunities. The third area is health and safety, and this category includes activities such as trainings on health and safety standards for providers, enacting minimum standards for providers, and monitoring activities to ensure that the health and safety of children is protected. So then we'll just walk through here an example of how subsidy payment works. And I just want to note this is just one way that subsidy payments can work. We're going to talk about certificates and vouchers, but we do know there are states out there that actually use contracted slots for CCDF. And this example specifically is for certificates and vouchers. So first we'll talk about the eligibility for the CCDF program. Parents to be eligible for the program must be working, in school, or in training. An eligible child is a child between the age of birth and 13 years of age, or 19 years of age if they have special needs. And then as for income eligibility levels, states actually have the flexibility to set eligibility levels based on either state median income or the federal poverty level. But family income must be at or below 85% of the state median income for people to be eligible for the program, and family assets cannot exceed $1 million. Once a parent or child is deemed eligible for financial assistance, then the state determines the amount of assistance that the parent will receive through a certificate or a voucher. And this certificate or voucher is then paired with a family contribution, which you would know as a copay or a family contribution amount, and that's typically decided using a sliding scale fee. The parent then chooses a provider who has agreed to accept the state's payment for child care on behalf of the parent, as well as to meet the health and safety standards laid out by CCDF. And then the care will begin between the provider and the child. So as Joe mentioned, we're going to cover the federal funding history as well as the 3 main funding streams that make up CCDF. So the CCDF program has a long history. It's been around for about 30 years. In 1990 was the first time that the federal government established child care for low-income working families. Then in 1996, when the Personal Responsibility and Work Opportunity Reconciliation Act was passed, this actually established CCDF. And this act replaced the Aid to Families with Dependent Children, or AFDC. The reason I'm mentioning AFDC here is a lot of the federal funding formulas for CCDF are actually still tied to the AFDC standards from the 1990s. So we'll talk a little bit more about that in the coming slide. And then in 2014, the Social Security Act renewed CCDF, and then in 2016, new rules for the program were published for the first time in 18 years. So you can see, although the program has been around for a long time, changes to it have been fairly slow in the past. So on the next side, we're looking at the 3 main funding streams that make up the CCDF program. There's mandatory, matching, and discretionary funds. All 3 of these funds are available to states. And then they're allocated, if you look over here in the left-hand column, the second box down, they're allocated to states based on different formulas. For mandatory funds, it's linked to the AFDC program that I mentioned before and spending that was going on in 1994 and 1995. For matching funds, these are allocated to states based on the number of children in the state under the age of 13 compared to the national total under the age of 13. And for discretionary funds, this is based on a formula that takes into account free and reduced lunch, per capita income, the number of children under the age of, and the number of children under the age of 5. And then on the left-hand side, the third box down, there's just one funding stream that actually requires match or MOE, and that is matching funds. And I need to mention that maintenance of effort is actually the spending levels that you had tied to the AFDC program in the mid-1990s. The state has to keep levels of spending up to the levels that were around in the 1990s. So matching funds do require a match and MOE. And then for discretionary funds, there is no match or MOE. However, funds typically can't be used to replace or supplant existing state funding for childcare. So in other words, discretionary funds really need to be in addition to your current allocation and not replace your current allocation. And then the last question here on the left-hand side is whether it requires an appropriation by Congress. And the only funding stream that requires an appropriation by Congress is discretionary funds. And this one actually, discretionary funds were increased in 2018 through the Consolidated Appropriations Act. And there was an increase of funding of $2.37 billion at that time. And that's substantial considering the overall budget for CCDF right now is about $8.6 billion in total. So there was a very large increase in 2018. So on the next slide, we'll cover when funds need to be spent by. And there's two different terms here. Obligation is an action that actually commits the funds, and then liquidation is generally when the payments of the funds have been made. So for example, an obligation is when you put a voucher or certificate out to a family, and then liquidation would be when you actually pay the child care provider. And there's different time frames for when each of these funding sources have to be obligated or liquidated. So for mandatory funds, if you request matching funds, you have basically 1 year to obligate the funds. If you do not request matching funds, there's no time limit for when they need to be obligated. And then there is no time limit to liquidate mandatory funds. For matching funds, this is a 2-year process. So in the first year that the grant is awarded, then you have to obligate funds. And then by the end of the following second fiscal year, you actually have to liquidate the funds. And then the third category is discretionary funds. So for discretionary funds, you have 2 years to obligate the funds, and then just 1 year to liquidate the funds after that. So that would be by the end of the third fiscal year to liquidate it. And then I'll talk a little bit about what happens to unspent funds. Unspent funds are either redistributed to other states or reallotted to other states, and then in some instances, the funds actually revert to the federal government. So for matching funds, any portion of the matching fund that is not obligated in the period for which the obligation was made or should have been made, then these funds are actually redistributed to other states. If a state is interested in getting redistributed matching funds, then they have to meet the matching fund requirements outlined in 98.5 CC of CCDF federal regulations. And this is the typical matching fund requirements that states have to meet. And I can, if anybody has any questions on and wants to hear this in detail, I can share it in detail, or you can find the regulations on 98.55C. And then also, if you want to receive the funds, you must request the funds on the ACF 696 report. For discretionary funds, so each year states are required to report to the Administration for Children and Families on their ACF 696 how much of their discretionary funds have not been allotted towards activities in the state plan. If the amount reported is less than $500 for an individual state or $25,000 in total, then funds will be reverted to the federal government. However, if it's more than these thresholds, so if it's more than $500 for an individual state or $25,000 in total, then these funds are actually reallotted to other states automatically in proportion to other states' allotments. And then just one other thing I wanted to add, for redistributed matching funds, these are considered part of the grant for the fiscal year in which the redistribution occurs and are subject to obligation and liquidation for the grant award year. For discretionary funds, however, these are reallotted to states and must be obligated and liquidated in the applicable periods for which they were originally awarded, or else the funds revert to the federal government. And I just wanted to actually stop here and see, I know that I just presented quite a bit on this one slide, and I wanted to just check in and see if anybody has any questions that they want to ask before we move on.
And this is Karen, and just wanted to mention that just recently we had a question about match, whether it could be an in-kind match, and for CCDF they don't allow in-kind match. It does need to be a cash or hard match. I don't know if you have anything more to say about that. And then are we going to talk more about redistribution reallotment later or not?
We have time to talk about it in the discussion section, but this is what we have for now. So if people would like to talk more about it, we can.
Yeah, I think we should wait till later. Thank you.
Okay, great. And I'll just mention, so Karen said it cannot be in kind. It can be, you can use public general funds. So if you have general fund or a special tax fund, you can use that for matching purposes. You can use public pre-K funds for matching purposes. And you can also use private donation dollars for matching purposes. But you, as Karen mentioned, you cannot use in-kind funds towards your matching dollars. And then, so we've covered the three main funding streams that make up CCDF, and I just wanted to mention there are several other funding streams that can be either blended, braided, or just paired with the CCDF program to support CCDF families. We're planning to talk more about this and go more in depth on this in a future webinar, but just for today I wanted to mention this as a basic. So CCDF funds can and are required to be used to support TANF eligible families. TANF funds can also be transferred to support CCDF families, so that's one funding source. And then there's other programs that you can use to basically support CCDF families. So Head Start, Pre-K, some states use IDEA Part C funds to support CCDF families. And then there are other states as well that basically pair their CCDF funds with TANF and workforce programs to try and support families in a seamless manner. So again, we'll have more time to dig into this on the blending and braiding piece, but we wanted to just bring it up today and open it up for discussion. So with that, I'm going to turn it over to Joe and Brian for the discussion questions, and we're happy to answer any questions that you have.
Thanks, Excellent. Ann. Thanks, Ann. Go ahead, Brian.
Oh, no, that was great. That's good basic information. We appreciate that, Ann. So we were wanting to see, we thought this might be a short discussion, but we wanted to put a little bit of time into it to see if anybody had any basic questions about this material so far. All right.
Hi, this is Kathy Rademacher.
Hey, Kathy. How you doing?
Good. How are you? I am
fine.
the fiscal specialist for the regional office. I have the states of Colorado, South Dakota, and Utah, but I've been doing child care for a long time, as many of you know. I just wanted to mention on the redistributed funds that a lot of times those come out very quickly. So you should have a plan in place for spending those. A lot of times you get notice from the Office of Grants Management with like 2 months notice to spend to obligate those funds. So I just wanted to throw that out there.
Thanks, Kathy.
So Brian, the second question here, we really wanted to kind of poll the group, and that was in regards to that last slide that Ann sort of presented there, and that is we've received a couple questions about this in my time with the center, and I know that this is something that a lot of my colleagues get within their states, within their regions as well from different states. So we really like to ask some folks to share what they do with the other funding streams that Ann mentioned. Maybe it's TANF, maybe it's the Head Start money or pre-K money. So would somebody be willing to kind of come off mute and give us an idea on what you're doing? Or to be quite frank, if you're not doing anything, if you're just using CCDF, because I know we do have a couple states, could we have some folks maybe come off mute and kind of give us an idea on what you're doing if you are doing something with other additional funding streams? maybe Utah or Colorado, do you guys have something that you would like to comment on there?
So this is Joe in Utah. We use both TANF and Head Start funds to support our child care program. With TANF, we transfer the funds in directly into CCDF and mostly pay for subsidy expenses with that. And then occasionally we use CCDF funds to subsidize our Head Start program if we spend more funds than they award us in Head Start. They don't give us a lot of funding for that.
Excellent. Thanks, Joe. I really appreciate you sharing that. Anybody else? Leverage funding similar to that? Jody, in Montana, do you guys leverage funding? It's just a question that I don't know the answer to. Do you leverage additional funding, or do you just do CCDF funding?
We do a TANF transfer, just like Joe was describing, as well.
Great. So, be thinking about that if that's something that you would like to share. We have a little bit of time at the end to open up some discussion. But I know that we've fielded questions like that before in the past of how other states do that. And, I know we've provided some material around, how other states outside of our region do that. So if you're one of those folks who are kind of thinking about that or maybe hoping or considering that right now, this would be a good time to ask some of your colleagues here, like a little bit more in-depth detail, like how they sort of do that, more of the mechanisms behind that. So, but with that, I think we're going to turn it right back over to Ann for the next section of the presentation then.
Okay, thank you, Joe. Okay, so in this next section, we're actually going to go over what lead agencies are required to and or allowed to spend funding on. And this section will actually cover what's in federal regulation as allowable uses of the funds and then limitations as well. So there's 5 topic areas that we'll cover. There's TANF eligible families, quality activities, child care services, limits on administration, and then child care resource and referral networks. So for TANF eligible families, at least 70% of your mandatory and matching funds must be spent on families who are either receiving TANF, making efforts to work activities to transition off of TANF, and at risk of becoming dependent on TANF. So you can see there's a large portion of your funding that's actually required to go to support TANF eligible families. The next activity that states are required to spend on is quality activities. So of your aggregate funds, this means your mandatory, matching, and discretionary funds that you expend, at least 9% of funds in fiscal year 2020 and beyond have to be used for quality child care activities. And then an additional 3% has to be used for quality activities for infants and toddlers. And these are minimum levels. Lead agencies can actually reserve more dollars for quality activities, but at a very minimum, at least 12% has to go towards quality activities. The next is child care services. So from the remainder of your discretionary allotment, after spending on quality occurs, and then there's the also allowed 5% spending on administration that I will discuss on the next slide, then states and territories actually have to spend at least 70% to fund direct child care services. Then of all of your remaining funds, after meeting the spending requirements above, so this is of all of your mandatory, matching, and discretionary funds, federal rule says that a substantial portion of funds must be used to support direct child care services for low-income families who are working or in training or education. And then we can talk about limits, or then we'll talk about limits on administration. So administrative costs are capped at 5%. You can spend up to 5% of your aggregate funds, so your funds in total from each fiscal year, on administrative costs. And there's 5 categories that you can spend on. You can spend on program administration, which includes salaries and benefits, travel costs, that you incur for official business, administrative services such as accounting services, other costs such as rental equipment or office supplies, and then your indirect costs, which these are your costs that don't count towards direct services, but say your rent or your overhead. That's all considered within your administrative costs and capped at 5% of spending. There are, however, several other categories that you can spend money on, and these are actually considered basically costs of running the program. It's not administration. You just consider this the cost of running your program. And I'm not going to read all of them just since there's 12, but I'll give you a few examples. If you need to do eligibility determinations and redeterminations, this is considered a cost of doing your program. Child care placement, training for child care staff, or if you're doing stuff around improper payment processes and investigation and recovery, then this is also considered, excuse me, this is also considered the cost of doing business, and it does not count towards your 5% cap. And I just wanted to mention, if you look over on the right-hand side of your screen, there's something that says Fiscal Fundamental Downloads. And for the administrative funding piece, we've actually just broken this out into handouts so that you could keep this. And if you are, curious, you kind of have it as a resource at your desk if you want to know what counts towards your administrative cap. And then the last category that is an allowable use of the funds is the Child Care Resource and Referral Networks. So you can use your funds to actually establish or support a system of local child care resource and referral organizations. And these organizations are meant to do a few things. They provide parents in the state with consumer education concerning the full range of child care options available. And you can also use these networks to help parents find the most appropriate child care settings to suit their needs. They also collect data on the coordination of services and supports for children with disabilities, as well as data on the supply and demand for child care services within a state. These networks are tasked with establishing partnerships with public agencies and private entities to increase the supply of quality child care in the state. And then finally, they are required to coordinate their activities with the state lead agency and other local agencies as much as possible. A CCR&R can be run through a lead agency. However, you can also designate a lead organization, such as a statewide public or private nonprofit, or a community-based or regional organization to run your child care resource and referral network. And with that, I'll turn it back over to Joe and Brian again to answer any questions that you have and to talk about the discussion questions here.
Thanks, Ann. We had a question pop up in the chat box while you were chatting, so I'll go ahead and read it off, and if you can answer it, great, and if not, we'll tap into Kathy. Joe Edmond actually asked, I know there's a different CFDA number for mandatory/match and discretionary funds. Is there a difference in what's allowable costs are for the different funding streams? So I'm assuming he's meaning between the discretionary, mandatory, and match funds. Are there different allowable costs for the different funding streams?
This is Kathy.
This one oh yeah, go ahead, Kathy.
I'm just going to pop in and say no, there are not any differences in allowable costs.
Well, that's short and sweet. Thank you very much, Kathy.
Sure.
And whoever asked the call about the different CFDA numbers, that did happen, was it 2019, Kathy? And I know some information went out about explaining that from OGM, I think, but if we need to follow up with somebody about that, let us know, and our OGM folks will contact you about that.
Karen, are you talking about the disaster funds?
I think it had more than just the disaster funds, Kathy, but I don't want to speak out of turn. I just know we've had a lot of questions about those some months ago, and the answers went out, but I don't have that like ready at hand, and I doubt that Ann has dealt with that.
Okay. So, Joe, I can get back with you.
All right. Sounds like Joe asking us on chat may not have access to audio at this point in time. So, Joe, could you put your email address in the chat box so we can make sure to get that information back to you?
No, I'm actually here. I
oh, hey, great.
Mute, so I was talking to myself, I guess.
Well, Gal, go ahead. Do you have any follow-up questions?
No, that answered my question. Thank you.
Perfect. Thank you. All right. Well, does anybody have any questions about that piece of material that is pressing outside of what Joe just asked? All right. So now we were wanting to find out, since we've got this nice increase in discretionary funds this last year, we were wondering how each state was planning on spending those dollars or have actually started spending those. So we're just going to go around to each state that was on and have a list of the activities that these dollars have been spent on. So I guess we can start with Utah. You've been the chattiest, so you want to jump on and tell us how you're spending these additional discretionary dollars?
We're focusing mostly on increasing subsidy expenses and spending by increasing our rates and making it so more people are eligible for the funding. That's what we anticipate the biggest piece of the spending will go towards. We're also implementing a quality monitoring system that's costing a lot of money.
Well, thanks. Quality monitoring system, investing in IT. I think a few other states are doing that. Who's next? Let's see. Let's do Montana. If you're speaking, Jody, you're on mute. Yep. There we go. Jody?
Jody, this is Robert. So Jody, are you still on? He may have had to step away, Brian.
Oh, no worries. All right. Well, let's jump into let's go to North Dakota then.
North Dakota, Amanda or Emily. Emily, we know you're very new, so if that's not part of what you've gotten up to speed about, that's fine too. Do you have an idea on what your plan is possibly for the discretionary spending, Amanda or Emily?
Yeah, this is Amanda. The additional discretionary funds were used to get us up to 75%.
Oh, excellent. Thanks for sharing there, Amanda. I appreciate that.
No problem.
Thanks, Emily.
Hey, Joe, this is Jody. Sorry, I was over in another office. We were having a audio problem, but I'm back now where I can talk. So
good deal. Good deal.
Yeah.
So your discretionary is what we were talking about, Jody. Is how do you guys have a plan, or what is your plan, or what are you thinking about on how to kind of redistribute or spend that?
So one of the ways we're doing it is we're looking to expand, try to get more people up and started. So we're doing some startup grants, some provider grants, as well as to help mitigate some low-key kind of emergency things so that they can stay open and stay operating. And we've had an amazing response to that. So sometimes they work with a licensor to identify, what do they need to get up and running. So that's been good. We've expanded some fingerprinting supports for our R&R agencies. Trying to think of what else. Yeah, just looking at expanding that capacity has been our main focus.
That's excellent, Jody. And just a real quick question on that, a clarifying question. Is that something that you are doing as the lead agency? Are you going through that process, the grant-making process, or are you leveraging your resource and referral system?
Yeah, very good qualifier. We are leveraging the resource and referral. They're doing a lot of that legwork with our support. And
Gotcha.
we're also using it, you know, to get to that 70% too. So, yeah.
All right, and this is a fun one. Sometimes federal dollars that you get extra are difficult to spend. Is anybody having a hard time spending these additional dollars and finding places to put these dollars out? Or has there been difficulty in actually spending the money? Noting that there's 3 years to spend these discretionary dollars is probably not as big of a deal, but sometimes it's difficult to get those dollars obligated and liquidated within the time frame necessary. All right.
Yeah,
well,
this is Joe in Utah. Sorry, yeah. We've struggled with that, or a little bit concerned with spending it. But with a 3-year time frame, we think we have plans to get it all spent. I think the delay is like the lag of increasing rates, and that there's a lag until you see the expenses actually hit. But so far, we're anticipating that we'll be able to spend the additional funds.
well, your providers will love you for that. Thank you so
Yeah.
much.
I doubt that, but we'll see.
Well, it gives them something to point to, right? Increased rates. Well, thank you. We appreciate you sharing. All right. Well, I'll give it one more shot if anybody else would like to share before we move on to the next session. Anybody else? All right. Great. Ann and Mike, I think, go ahead and take the rest of the session.
Okay, thanks, Brian. We're going to talk about priority populations now. As Joe said earlier, we won't spend a lot of time talking about this topic because for the most part, Region VIII is already serving all eligible applicants. I believe 5 of the 6 Region VIII states don't currently have a waiting list at all. The only state that does has 4 of their 64 counties with a waiting list. So let's use these slides more as a reminder of what the requirements are for priority populations if you don't have enough funds to serve everyone. Okay, the CCDF final rule requires that priority be given to families with children with special needs, which may include any vulnerable populations as defined by your lead agency. Special populations to consider include, as you can imagine, low-income families and homeless populations. You should always strive to prioritize increasing child care access to families that live in areas with a high concentration of unemployment and or insufficient high-quality child care programs offered. Lead agencies are also required to spend funds to improve access to child care for children experiencing homelessness. Examples of efforts to increase access include outreach, training to providers to help them identify and better serve this population, and grace periods for enrollment and other health and safety requirements, like immunizations, for example. And remember, if a family has a child with special needs, lead agencies have the discretion in how they encourage program access. So a couple examples of this discretion includes waiving copays altogether or offering lower copays on a sliding fee scale. All right, we're going to stop here and see if anybody has any questions or comments about how you define or serve priority populations.
We actually didn't think there'd be a lot of questions about this one since the Region VIII context doesn't have very many wait lists, but are there any particular states that have a unique group that they're pulling out and trying to prioritize that they'd like to share?
Hey, Brian, this is Joe. And just a real quick context, and I know, Joe from Utah, this may or may not be your bailiwick, but I know that we recently facilitated a peer-to-peer with Utah and Delaware, because Delaware was looking at possibly considering how they address families who are experiencing homelessness. So just as a point of resource within our own region here, know that Utah has some interesting, they're utilizing funding and leveraging it in some interesting ways to get not necessarily a priority to homeless populations, but making sure that those families that are experiencing homelessness get quick access to sort of provisional eligibility through some of the programs they've got. So if anybody else is kind of thinking about that or considering that population, they want to touch bases with our friends from Utah.
Thanks, Joe. All right, well, let's move on to the next section.
All right, let's keep going. All right. Federal reports. Just want to spend a little bit of time covering some fiscal federal reports required for CCDF. We've got one slide for you on this. We've provided a chart here with information on some of the federal reports that you'll come across, most often pertaining to fiscal operations. And as Ann mentioned earlier, this is one of our handouts. So we've saved this so you can use it as a quick reference or share it with relevant staff if you need to or want to. So I'm just going to briefly go over each of the reports displayed on the chart, highlight what data is collected, how often this info is reported, and what it's used for. So feel free to stop me anytime if you have any questions as we're going through this. All right, let's start with the ACF 801. This collects case-level child care program information for CCDF, as outlined in the final rule. The specific site for that is 98.70 through 98.71. This report is submitted monthly or quarterly. And the information provided from this report provides research data to the Office of Child Care, which they in turn are required to provide to Congress biannually. We've talked a little bit or referenced at least the 696 earlier in this presentation. This report provides the financial data on CCDF expenditures for the mandatory, matching, and discretionary funds. The report is required to be completed and submitted on a quarterly basis for each fiscal year grant award until all funds are expended. And that's important because since CCDF funds from a given grant award may be available for use in more than one fiscal year, it's feasible that you could be reporting on multiple grant awards simultaneously in your report. Reports are due on January 31st, April 30th, July 31st, and October 31st of each year. OCC uses this information to ensure funds are being spent in accordance with the CCDBG Act. The Quality Progress Report collects information from states to describe investments made to increase access to high-quality child care for children from birth to age 13. The regs require that lead agencies submit an annual report describing how funds were expended, like the activities and the measures used to evaluate progress in meeting the requirement. This report is due annually on December 31st. and it describes the state priorities and strategies to key stakeholders, including Congress, federal and state administrators, providers, parents, and the general public. And then finally, on this chart, everyone's probably familiar with the 404 report. This report captures error and improper payment findings and analysis from case reviews. The report and the activities associated with it occur on a 3-year cycle. The report's due by June 30th of your reporting year. So we're currently in year 1 of the cycle, which means Colorado and North Dakota are the lucky states right now in Region VIII participating for this year. Year 2 states in Region VIII are South Dakota and Utah, and the year 3 states are Nebraska and Montana. The data provided to OCC for this report is used to identify programs and activities that may be error-prone, and this information can also be used by state agencies to identify training needs and help reduce future improper payments. Any questions or comments from anybody about the reports we've covered here today? Like Ann said before, we went through a lot of data quickly, but we've definitely got time to discuss any questions you may have.
Yes, and I just wanted to add that these are some of the reports that are required. They're not all of the federal reports that are required to report to the Administration for Children and Families. There are other ones as well, but we tried to capture the main ones that you'll probably spend a lot of time on.
Right.
Okay.
Okay. Then if we don't have any questions related to the reports, Ann, I'm going to turn it back over to you.
Okay. Thank you, Mike. Great. So in this section, we are actually just going to talk about a few factors that can impact your budget if you have a limited CCDF budget. And we're going to cover 3 main areas. There's reimbursement rates, eligibility levels, and copays. And the reason we're discussing this today is that we want people to understand that when you make changes to one of these areas, it's likely that you're going to, without additional funding, you're going to have to think about reducing potentially services. So for eligibility levels, that's your entrance and exit rates into the program. So you might have to serve fewer people, you may have to increase copays, or you might have to reduce your rates. So you can see in the example on the left-hand side, if you were to increase your eligibility levels and accept more families into your program, then you may have to reduce the rates that you are paying providers. If you are looking on the right-hand side here, if you're looking at increasing your rates for providers, then you may actually have to reduce your eligibility levels or increase copays to pay for families in the program. And we are currently at NICSIA, we are currently developing a budget tool that we're piloting that I'll talk about a little bit more in just a minute, but basically we're trying to help states understand what the bottom line impact would be to their budget if they have to make adjustments in one of these 3 areas. So we mentioned this here today because it is a consideration that you know, we want you to keep in mind.
And
so I'll turn it over to
I really appreciate you including this context today, because we have heard from states over the last few years that some of their projections when they increased payment rates or increased eligibility levels actually didn't cost them as much as what they had been budgeting for. And so I think with, you know, that previous discussion we just had about, you know, how are you getting money out the door and ensuring, you know, timeliness not only of the additional direct expenditures, but you know, the other additional discretionary money. And I think that context that you're talking about and potential tools to help states is really going to be great.
Great. Okay, well, so I'll turn this section over to Joe and Brian, and we can discuss any questions that you have on this.
Well, thanks, Ann. So this is the one of the last sections of questions that we have, and so based on that last bit of information, we were just wondering if anybody has any questions about CCDF funds and how they can be used. Any particular questions about ways that you want to spend the money that you'd like to ask about right now? And then this last one here is, does your state or territory face any challenges with adjusting copays, eligibility levels, or these reimbursement rates that we were just chatting about? So any surprise stories on the positive side about, actually having more money left over, like Karen said, that you want to share with everybody about coming up with increased rates or decreasing your parent copays? I think Jody, you were saying that you increased your rates. How did that affect what was going on in your program?
It didn't have a major impact. I mean, it helped us get to that level that we wanted to. We have kind of a unique thing in that we're not regionally broken up. We have one state rate because we have so few people. Our sample size is so small that it's set at a regional level for the whole state. However, not every provider, some of our more urban areas, may charge more than some of our more rural areas. So that's something we're looking at. We're just starting our next market rate study now, and that's one of the things we're going to be looking at. So not exactly in line with the question you're asking, but it's still something that we struggle with.
What does your analysis look like? I mean, when you decide to raise something, what data are you looking at, and where do you get that data from to be able to put those formulas together?
Well, that's one of the things our market rate study is going to be looking at too. Is are we doing that the right way? Right now, it's just an aggregate, and we just look at that and just see what the impact is.
Well, thanks, Jody. Does any state here have a question for another state about how some of this work is done and some of the impacts they've experienced, just to kind of get a kind of a state-to-state discussion going? Okay, well, if there's not one, Joe, go ahead.
And Brian, I know just a real quick, this is an opportunity to give a real quick shout out. I know that we have done, we've worked with Wyoming recently, and they went through a process recently where they very thoughtfully considered how they wanted to kind of increase some of their rates and do their, and cover registration costs. They also looked at some of their attendance policies. So I know Eve is on, but I don't know if she's able to discuss or not. But Eve, kind of a similar question. Now that you guys have had that in place for a little bit, have you seen, what kind of impact have you seen in your provider community or families or anything like that? Have you gotten feedback that those increased rates and the registration costs that you guys had adjusted, have you seen a net positive, or have people responded to that positively? I don't know if Corinne's with you or.
This is Eve. So it has been positive. We're not seeing as much of an increase yet that we were anticipating, but it's slow and it's gradual with that and our increased rates and the 85% of attendance we pay full authorization. So that's slowly growing, and we figured it would grow each month. I haven't heard anything negative yet, but it looks like it's starting to be okay.
Yeah. Well, like I said, you guys did a really good job of thoughtfully kind of walking through that process, and I know it was a lot of hard work on your guys' part on that, anticipating. So that's good. Hey, not negative is good. I don't know how it could be negative if you're given more money, but no, that's great. Thanks for sharing, Eve.
All right, let's move into the last section. Thank you.
Okay, great. Thank you all for the discussion today. So we're just going to talk a bit here about tips and resources and then next steps. So I just wanted to cover what's next for NICSIA and let you all know of some upcoming fiscal TA opportunities that you could participate in. So this is our first Region VIII capacity building webinar on fiscal topics. And we're looking at doing a follow-up webinar, and we're considering topics like maximizing federal funding, including grading and blending of funds, as I mentioned earlier. And we'd also love to hear from you all either at the end during the discussion time or in the evaluation, what other topics would be of interest to you all, because we really want to make sure that this series of webinar trainings fit your needs as states. And then the second opportunity that we have are peer learning groups. So we at NICSIA are very soon rolling out a set of fiscal peer learning groups where it will be just a small group of states, and it's really meant for states to talk to each other. It would just be NICSIA and the states. And it's an opportunity to talk about different topics. So some of the ones that we are exploring right now are sound fiscal management processes to ensure program integrity, mitigating the cliff effect, and managing competing budget priorities, as we discussed today. So as those come out, we'll be sure that you all are aware of them, and if you'd like to participate, please let us know. And then the third is the CCDF Excel budgeting tool. So as I mentioned before, we are just about to pilot this with up to 5 states in early 2020. And we are looking for states that want to participate, but it's really meant to help you, like I said before, understand the bottom line impact to your budget if you change eligibility levels, copays, or reimbursement rates, and help you basically estimate what the impact will be to your budget. And so, again, if you're interested in that, you can mention it at the end or on the evaluation form. So those are 3 opportunities that we have coming up, and we hope you'll participate, and thank you for your time today. So I'm going to now turn it over to Brian to close us out.
Well, everybody, I want to thank you for attending. I want to thank Ann, Mike, and Joe, and Kathy Rodemaker for spending the time to answer a lot of our questions and to put this together for us. I do want to let you know that it was recorded, so if you do want to have somebody watch it for future reference, it is going to be available and sent out to the roster of people on this email list. Also, just to let you know, there is an evaluation at the end of this, and we want your feedback to improve on this process, also to improve on this particular set of materials. Your comments won't be seen on the screen. They will be private, so you'll be able to provide that stuff to anybody assessed for us to be able to improve this. So before we get into it, we have about 15 more minutes of time that we can kind of have for questions and answers, and so we just want to know if there's anything that you would like to hear that we didn't go into enough detail on. So let's just start there. What would you like to hear more about?
So while everybody's thinking, this is Karen, and we've had several states speak to us this year about challenges with their legislative auditors and the CCDF staff trying to really explain to auditors the actual funding requirements and fiscal management for CCDF, especially around obligations of subsidy funds. And Ann, I just wondered if that's something that will be part of our conversations in that advanced webinar.
Yeah, that's something that we have talked about covering, and we can definitely include if there's interest in that.
Great. I think for sure Colorado, Montana, and I think Utah are the ones that have brought that up within the last year. So I think that'll be great if we can consider that. Also wanted to mention, I don't think we talked about this, if for any reason you feel you're not going to be able to obligate your funds by a deadline, there is an April 1st date to notify Office of Child Care, and I know Kathy has talked with states about that in the past. It's usually some of the tribal grantees that have had to experience that more than the states, but I know that that has come up in the past, and so just wanted you to be aware of that. If you think that's going to be an issue, please contact your program specialist and we'd give you more details about that. And then if we're going to talk a little bit more, Kathy, did you want to talk any more about the redistribution and reallotments at all?
Not really, unless people have questions.
I think we just want to remind you that we want to ensure that everybody is always eligible to receive those. So that's why the timely reporting is so important, and making sure that if you have any challenges with the system, you let the help desk know immediately so they can resolve those quickly.
And I am also available for any OLDC issues. We can get those recorded and work on getting those fixed as a team.
Emily, I know as a new person, you're just getting ready to have the fundamentals training about CCDF. Was this training helpful to you, or did it just kind of feel overwhelming, like I don't have enough context?
I found it actually very helpful.
Okay, great. Jody, you've been on about a year now. How about for you? Was it still helpful information?
You're rushing me there. It's been about 7 months.
Oh, 7 months.
Feels like a year or two. No, this is good, and I want to continue participating in these. So thank you.
Joe, as such an experienced CCDF fiscal management person and someone who has gone through transitions in reporting with all of us, is there any other advice that you have that you would want to give to other states about, you know, kind of stay on top of this or make sure you're paying attention? We're finding that there is definitely a disconnect between the state administrator and their staff sometimes and how they think the money has been budgeted and is being expended versus what's on their reports. So I just wondered if you had any advice about that.
Yeah, I would, I guess, just advise to work closely with the program staff. I know the way they calculate expenses and the way they end up getting reported are a lot sometimes different. They're anticipating a certain amount of expenses based on what they budgeted, but don't always factor in, you know, expenses that don't materialize. So I would say just have a good coordination with your management team in the program and coordinate that way.
I promised we didn't pay him to say that, but thank you, Joe. It means a lot more coming from folks that have lived it.
This is Ramona from Region VIII in Denver. Hi, all. Kathy, can you give me a quick walkthrough on how the redistributed funds work? I know I'm going back reading through my notes, and you say it comes out very quickly, and you stated that the state has, make sure that the state has a plan to expend. Can you walk me through a scenario how the redistributed funds work, for example? Are you able to do that?
So from the OGM point of view, based on that April 1st date that Karen mentioned, for notifying Office of Child Care about any excess funds that are not going to be obligated or liquidated, that happens. So that happens around April 1st. Office of Child Care gets with Office of Grants Management in central office. They have to work out the formula for redistribution to the states that are eligible, and that's based on the 696 report and whether it was received timely or not, whether the state wants redistributed funds, and if the state has an amount. In the past, I can remember Wyoming saying they only wanted like 7.5 million or whatever, so they had a cap on the amount that they were requesting, if available. So then that has to go through OGM's formula calculations based on all of that, and that takes some time. And with us looking at the new processing in Grant Solution versus how we used to do it, that's taking even additional time and trying to get the formulas correct. So that's why it takes some time to get those grant awards for redistribution out. And that's what makes the time frame a lot quicker, shorter for states to then get those grant awards and funds and get those obligated. Sometimes it's as close as 2 months, like I said. So from April 1st to September 30th can be a shortened time frame, and that's how that works.
Okay, so that comes back to the point, driving the point home is when they have those year-end reports in, whether it's the state or the tribe, they have to have those reports submitted in on time for their due date, step number 1, to make sure that they will be eligible for those allotted funds, correct? And then by April 1st, the Office of Child Care and Office of Grants Management get together and work out a formula to see what each state is eligible for. Is that correct?
Yes.
Okay. And then by October 1st in that next fiscal year, then that's where the reallotted funds will be given based off of those formulas that were done between April 1st and September 30th.
Well, that the redistributed match is mainly what we're talking about. Occasionally we have the reallotted discretionary, but it's been mainly the redistributed matching funds. And, you know, so the state would have, say, there are 18 funds, they come out in 19. You know, they would have to have those obligated by 9/30.
And have their state share match.
Yes.
Say that again, Karen.
So if it's the redistributed matching funds, the federal government is giving states a certain amount based on the formula, but a state would have to be able to contribute their share of the matching funds.
Right,
so
that's correct.
Another
Okay.
reason why that, you know, August, September short turnaround ends up being challenging for some of the states.
Okay, thank you.
Thanks to both of you for kind of re-emphasizing that, because just with having some newer folks on, we've learned that this redistribution is really confusing. And when they said that you have to say it on the 696, not only submit your reports timely, but you have to mark it on the boxes that say your state wants that. And in the past, Kathy would always check those, but we have a whole different OGM restructuring now, and so you can't count on somebody else reminding you to do that. So you have to identify you want it, and then once they have the amount, the other thing that happens quickly is OGM contacts the states very fast and says, you know, you said you could take up to whatever, $700,000. Do you still want that amount of money? And then the state would have to say yes or no before the grant would be issued.
And Karen, OGM is still trying to follow that procedure. And for Region VIII, you just have Ramona and I now, so we're trying to make that a consistent procedure.
Great. Hey, for some states, every little bit counts, so we want you to get any extra. I'm surprised nobody raised other topics. Are you sure there aren't other topics you want to bring up for fiscal management and optimizing your CCDF funds?
Amanda, do you want to say a little bit more about the audit discussion that year and the things that you'd like to know about the audit? She mentioned in the comments that North Dakota is very interested in the audit discussion. Is that you, Amanda? All right. Well, Ann, maybe you can speak a little bit about how some of these future webinars would speak to the CCDF audits.
Well, I mean, I think what we would like to do is just really, maybe this is something that you can talk about in the evaluation, is just what specifically you'd like to learn more about the legislative audit piece, and we'd like it to be responsive to any issues, because I imagine the issues will be different based on what states have coming down the pike from their auditors. So if you would like to just let us know, that would be great.
Thank you, Ann. Thank you, Amanda. Oh, we'll give it a few more minutes if anybody has any kind of last-minute questions that they'd like to ask before we close out. We're coming close to the end of time. We do have about 10 more minutes, so if anybody has a question while you've got some of these experts on the line, this would be a great time to ask.
Did anybody else join the call that we didn't get to acknowledge from any of our states? Okay, we knew some folks might have to join late, so I just wanted to make sure that we said hello. Thanks, Brian.
Thank you, Karen. All right, well, we all want to thank each of you for your time. We know that you have more time than, you have less time than you actually have time to get things done, so thank you so much for sticking with us for an hour and a half. Please wait and fill out the evaluation so we can do better next time, and we appreciate everything you do. Look forward to chatting with you soon. Thank you, everybody.